Funding for Yale Cancer Answers is provided by Smilow Cancer Hospital. Welcome to Yale Cancer Answers with the director of the Yale Cancer Center, Dr. Eric Weiner. Yale Cancer Answers features conversations with oncologists and specialists who are on the forefront of the battle to fight cancer. Here's Dr. Weiner.
Tonight's show, we're going to be focusing on the social and emotional challenges that can come up with cancer treatment. Cancer is, of course, a medical problem that people confront, but accompanying the medical issues are also a complex set of emotional and psychological challenges. Many patients going through cancer treatment and many survivors struggle with these psychological and emotional and social adjustments. Joining us this evening is Dr. Nancy Borstelmann, an expert in psycho-oncology. Dr. Borstelmann is an assistant professor in the Child Study Center and the chief of Family Behavioral Health Services in Hematology Oncology. She now also is the co-director of the Yale Cancer Center and Smilow Cancer Hospital's Early Onset Cancer Program, which is addressing the needs of individuals with cancer who are between the ages of 18 and 45. And as you can imagine with her background, she is focused on the psychosocial part of that program. So Nancy, it's a pleasure having you here tonight and joining us for Yale Cancer Answers. I think maybe we can just start pretty broadly, and maybe you can just talk in general about the complex psychological and emotional issues that people with cancer face. And you can't do this, you can't cover the entire territory in a sentence or a paragraph. You could write a book on it. But what are some of the highlights?
So let me give you a few broad categories that are somewhat common across cancer diagnoses, the whole age spectrum. So anxiety, dealing with a disruption of cancer, like cancer in your life, can lead to a lot of worries and a feeling of overwhelm. Sometimes depression, intense feelings of distress. I don't even understand what's happening to me. And suddenly I have to drop everything I was planning in my life and figure out how to deal with this.
And let me just ask you, I would imagine that anxiety is almost something that virtually everyone experiences, whereas symptoms like depression and feeling down may be something that people experience. Everyone probably experiences it intermittently, but true depression that is persistent and pervasive is probably a little less common than anxiety. Is that the case?
Yes. Absolutely. Anxiety is probably the most common emotion experienced, and that runs a spectrum as well. But when it comes to depression, clinical depression, so something that is more severe and persistent and is really interfering with a person's life, to be differentiated from understandable feelings of sadness and loneliness or just overwhelm or confusion. What's happening to me and what is this going to be like to go through cancer treatment? How is it going to affect me?
And that anxiety, of course, also can take many different shapes and forms. Some of the anxiety is just over things like making appointments and going through tests and dealing with so much that's unknown. Some of it, I imagine, is also related to having to tell family members and friends. And then, of course, some of it, because in our society, cancer is greatly feared, is about what cancer treatment is going to mean and the potential that it could threaten somebody's life.
It's all of those. And for different people, depending on who they are, who's in their support network, and to what extent the cancer treatment is going to really disrupt their life, it will factor in. For example, these logistical issues. Is there someone who's going to help them out with that? There's a lot of appointments. There's a lot of schedules. There's insurance. There's all these things that you just may not know quite how to deal with. Then if you're trying to figure out, how do I tell, if you say you have children, how do I tell my children, even your adult children, if you don't have young children, how do I tell them? What do I tell them? When do I tell them? And the many other ways that you have to then kind of reconfigure things. And all of that can lead a person to try to, how do I problem solve? I don't even quite know what to do.
Yeah, no, it's incredibly complicated. We talked recently to one of your colleagues, Rachel Greenup, one of our breast surgeons who does research on financial toxicity. And she was talking about how anxiety-provoking all the financial aspects of cancer care can be. And I'm sure that comes up in conversations with patients.
All the time, because cancer care can be expensive in ways that you may not necessarily think about. So if I have to cut back my the amount that I work, or my spouse or partner does as well, I have all these maybe unexpected expenses, childcare, medication, copays, and so on and so forth. And no one wants to deal with insurance. It's just sometimes hard to know, how do I even fill out these forms? So yes, it can feel incredibly overwhelming, and financial toxicity is a real thing.
Yeah, and not surprisingly, I think as a doctor, I hear about these concerns from patients relatively infrequently because they don't want to take up my time with it. But as social workers, I think that this is something that comes up frequently.
It does. It comes up, and actually, it's good that it comes up, because whenever patients are carrying a level of worry and concern that just adds to their distress, I think we all, as an oncology team and as clinicians, want to do whatever we can to help reduce that. Where can we relieve some of the burden? And there is help out there. However, we want to hear about it, and we also need to ask about it.
Yeah, and maybe we can just focus on this whole area of communication with friends and family. And in a minute, I'll ask you about the communication with children, whether it's a patient's own children or other children that they may be closely related to. But first, how do you advise people when they ask you about communicating with their friends and family members and what they should say? And sometimes people are afraid of the kinds of responses they're going to get.
I think it's important for the person who has those worries or just is wondering to try to tell us what it is that they're worried about. Just as you were saying, Eric, is it that people are going to say things to me that I don't know how to answer yet because I don't even have a treatment plan? Or is it that they're going to get upset and then I'm going to have to manage the fact that they're upset while I'm already upset about that I'm dealing with cancer?
Yeah, I mean, so there are people who often comment that they feel like they have to support their friends more than their friends are supporting them. And my response to that is that's probably not somebody who's going to be very helpful to you during your cancer journey, even though they may be a very close friend.
Yes. And I think that's an important point, is that people sometimes surprise you. Sometimes people come out of the woodwork and are incredibly helpful, and others who you thought might be more of a support may just struggle more with how to be that friend to you. I think the other thing is trying to help the patient think through some of the, like, what would it be like to have that conversation and do kind of a role play in some ways. Like, what are you anticipating? And also, sometimes you have to help them think, what's your tweet? What's your tweet? What's an email? like what's the short form of communication that might just help you in different types of situations. So you don't have to tell the whole story, but sometimes it's good to have a little rehearsal of what some of those conversations might bring up. And then that'll help you feel prepared. A little more prepared goes a long way.
So I think one of the most challenging areas for people is talking to their own children, and particularly, well, children of any age in truth, but particularly children who are under the age of 20 or early 20s. And of course, it's harder and harder the younger the children get. How do you advise people? And I'm sure that varies based on the age of the child.
Absolutely. It's important to think about the age of the kids and what might be developmentally kind of information that's going to be helpful for them. I think, first of all, I'd want to know, how many kids do you have? What are their ages? Tell me a little bit about them. And then, in so many words, kind of put out there that a philosophy that I think is held up well is that open communication with children is the best thing to help them. And of course, there's a timing issue here too. So when you're newly diagnosed and you're just beginning to figure out what's going on, when you have an actual plan, then maybe that's the time to talk with children. And to make it clear, you don't have to say everything. Just tell them what they need to know right now. For example, sometimes things are really observable to children, like their schedule's different. Different people are going to be picking me up or dropping me off. Maybe there's going to be a change in how you look, say hair loss or some other change. So they're going to notice those things. So it's better to prepare them and let them know that this is what's happening and this is what you're doing about it, and making them feel more safe and secure because you're sharing that.
And how does the approach differ with a, let's say, 3 to 5 year old versus a 10, 12-year-old?
With a 3 to 5 year old, it'll be harder for them to understand the kind of the intricacies of this, but they can understand that there is something changed in the family. So it's really helpful for them to know that, say, a change in schedule is going to be like this, and here's the person who's going to help take care of you, and so on and so forth. So you sort of lay out what are the things that might disrupt their usual routines, because kids, all of us as people, we rely on our routines that help us kind of keep our stability. So for younger children, that's a lot of it. And then sometimes a younger child, maybe a 4 or 5 year old, can understand that there's an illness, but it's not something that it's cancer. You can't catch this. It's not like when your brother had a cold and then you got a cold. So, and some things like that, because sometimes children misunderstand and apply something they know to your situation, which isn't the same thing.
And the older child, the child who presumably knows what cancer is because they've heard about it already.
Yeah, I think that child can hear a little bit more and can understand, and in fact may have a lot of questions, because and I think as a parent, to be helpful to them is to kind of warmly welcome questions, so that children aren't keeping things and worrying without talking about it. That's probably the thing you want to make sure and help them with the most, is that this is something we can manage and we can talk about.
Well, we're going to have to take just a brief break, and in a minute, we will be back with our guest, Dr. Nancy Borstelmann, an expert in psycho-oncology and how we communicate with both our patients and how we help them with their emotional needs.
Funding for Yale Cancer Answers comes from Smilo Cancer Hospital, where nationally renowned breast cancer specialists deliver compassionate, cutting-edge care. Learn more about innovative treatment options at smilocancerhospital.org. Over 230,000 Americans will be diagnosed with lung cancer this year, and in Connecticut alone, there will be over 2,700 new cases. More than 85% of lung cancer diagnoses are related to smoking, and quitting even after decades of use can significantly reduce your risk of developing lung cancer. Each day, patients with lung cancer are surviving thanks to increased access to advanced therapies and specialized care. New treatment options and surgical techniques are giving lung cancer survivors more hope than they have ever had before. Clinical trials are currently underway at federally designated comprehensive cancer centers, such as the Battle II trial at Yale Cancer Center and Smilow Cancer Hospital, to learn if a drug or combination of drugs based on personal biomarkers can help to control non-small cell lung cancer. More information is available at yalecancercenter.org. You're listening to Connecticut Public Radio.
Welcome back to Yale Cancer Answers. I'm Eric Weiner, and tonight we've been talking about the mental health challenges that come with surviving cancer. This could be social and emotional aspects of having a diagnosis, and it's also about how we can support our patients in going through a cancer diagnosis. I've been speaking with Dr. Nancy Borstelmann, who has played a really critical role, both in her former position at Dana-Farber and now more recently at Yale in this area. So I want to start off by talking about some of the work that you and your colleagues are doing in our early onset program focused on patients who are 18 to 45 with a diagnosis of cancer. And in particular, I want to ask how it's different for younger people with cancer versus a 60-year-old, a 70-year-old, an 80-year-old. And because, of course, part of the reason for creating this program was because I think a lot of people perceive that it's just that much harder for a young person.
So for anyone getting a cancer diagnosis, it is distressing. There's a lot to take in and take on. For younger patients, there are more distinct or unique needs because of the age that we're talking about, 18 to 45. So particular developmental milestones that might be part of their plan, but also could be very much disrupted by cancer treatment and everything that involves. So, for example, fertility and family planning is a common concern because that may be I'm planning to have maybe dating, or maybe I have a partner. I'd like to have a child. What does this mean for me? Which would be very different than for somebody in their 60s.
And of course, there's also the issue, and we were just talking about this, about having to talk to young children. If you're a younger person, you're more likely to have young children. And then, patients will often comment that they're sitting in the waiting room and they're 28 and they're surrounded by people who are not 28. They're 48 and 58 and 68 and 78, and they just feel that much more alone.
The feeling that you're describing is a common one among younger patients because of that very reason. It's like, how did I land in this waiting room? I look around and where my peers aren't here. Why am I here? So that feeling of isolation and loneliness, and disruption to one's life while talking with friends or looking on your social media apps and seeing everybody's going about their life and what's happening to me.
And I could imagine that the reaction that a 30-year-old gets when they tell their friend that they have cancer might be very different than the reaction that a 70-year-old gets when he or she tells their friend that they have cancer. It's just something that the friend or family member may be more used to, whereas if you're 30, you reach out to your friend, they're going to be shocked by this.
Exactly. The friends are shocked because it seems to have come out of the blue. It brings up, well, as you are noting, Eric, if you're older and you've been through a number of life experiences, maybe other health issues, people are in some ways have, these things happen, and you learn a way to respond. And if you're 30, however, not only does it, maybe you find it hard to know what to say, but also it brings up your own worries about mortality. Because everyone hears cancer and they think, is my friend going to die from this? And those fears are universal. And now somebody who's younger may or may not know how to actually manage their own reactions to this.
So I want to spend a little time focusing on how we can help people deal with the emotional challenges that they face. And I can think of three groups of people that I want to talk about. First, there's the friend, the family member. What advice can we give to friends and family members about how to approach somebody with a new diagnosis with cancer? The second, which we'll get to in just a minute, are healthcare professionals. So the doctors and the nurses who are seeing patients in the clinic, in the hospital, and who sometimes are great. And sometimes I think we can all admit that we're not all great at dealing with some of these emotional challenging situations. And finally, I want to talk about what mental health professionals can do to actually help patients. So first, let's start off with the family member or friend. What advice would you give to someone like that?
I would say be a good listener and be curious, ask questions, be available, and, ask how you can be helpful, or try to keep a conversation going, because sometimes people don't talk to each other because and it's meant well to say, oh, I don't want to be burdensome. I don't want to add, and protection, feeling protective. However, what ends up happening is you end up isolating the patient inadvertently, certainly not intentionally. So be curious and be a good listener, and ask what people need. How can I help?
And I would imagine that, though said with all the best intentions, that comments like, I know you're going to be okay, you're a great fighter, could get perceived as not necessarily what the person with cancer wants to hear. Yes.
While there's some benefit to positivity, to encouragement, that can be a good thing. However, it's not the only thing. So I think that you have to be sure that you're not shutting down conversation. So in other words, a person has to be allowed, in so many words, given permission to talk about what's kind of inside of them. I'm scared. I'm worried. I'm confused. I don't know what's going on, or I'm angry. I'm upset, whatever it is.
Yeah. It's, it is so important. I think your point about being a good listener is critical. And then let's move on to the other healthcare professionals. So doctors, nurses, others, sometimes I think patients feel totally supported by people who are around them. And I think that's probably more common than it isn't. And, patients will talk about the great support they have from their nurse in the infusion room or from their physician or what have you. But as I often say, there's nothing worse than an anxious patient and an anxious doctor, because together they can really create a lot of discomfort. So what advice would you give to doctors and nurses about talking to patients? sometimes this is, I have to say, I think sometimes, particularly in medical school in the past, this is not something that a lot of people paid attention to, more today than in the past.
Yeah, I think it's, as you were mentioning, the anxious patient, anxious doctor, I was just thinking it's a good framework, because as a physician or a nurse, it's like, here's your patient in front of you, and how are you feeling? So it can be helpful to just actually connect with that, and then see where you can put that so that you can be available to the patient and not be managing your own emotions in this situation, which, sometimes our how we're feeling in the moment is affecting what we do and what we say and how we look. So it can inadvertently make it harder for the patient maybe to talk about their own needs, concerns, and worries and questions, because they're sensing, maybe I shouldn't talk about this, or my doctor doesn't have time.
And I've been struck for years that patients pick up on everything going on in the room. As a doctor, if I have for whatever reason some different expression on my face than the patient's expecting, then they're all over it. Mm-hmm. And so I think it is something we have to pay attention to. And finally, what can we do in terms of interventions to help patients? I mean, there's psychotherapy, there's group therapy, there's medications. How do you think about this?
So there are a lot of different ways to get help. And I think, and people vary by what's helpful for them. So you mentioned group therapy or support groups. For some people, that issue around social connection and peers or social belongingness. So a support group may be just the right thing. Sometimes meeting with one of the clinical social workers in the oncology team can be a good way to get started in exploring what are your primary needs and concerns, worries. Are you depressed? Are you worried about your family, about whatever in your life? So starting to get it, I think, out of your own head and your own kind of behind the door, someplace where you can start to look at it. You also mentioned. And
can I just interrupt for 1 second? So patients will sometimes say, I don't need to talk to a therapist. I can talk to my friend.
So I think talk to a friend. Talking to a friend is great, because we need our friends. However, talking to a therapist, a social worker, whomever, a trusted professional is someone who's objective and doesn't have the kind of skin in the game in the way that can be harder for a friend. And you need to be able to say what you need to say without filtering. And no matter how we try, sometimes with friends or a family, you will do that filtering.
Dr. Nancy Borstelmann is the Chief of Family and Behavioral Health Services at the Yale Child Study Center. If you have questions, the address is canceranswers@yale.edu, and past editions of the program are available in audio and written form at yalecancercenter.org. We hope you'll join us next time to learn more about the fight against cancer. Funding for Yale Cancer Answers is provided by Smilow Cancer Hospital.